So in terms of design, the NHS Institute, when we first began, we started looking at what was it that made successful organisations, what did successful, innovative organisations do that was different. And one of the things was that actually it was about using a process, and the ones that we were particularly interested in used a design process, and we worked very closely with IDEO, a big design organisation agency, in developing our work process and our way of working. So all of our products are designed in that way, so it's very much about co-production with NHS staff in developing the right products to be able to transform services. And as we were doing that, we were sort of, well, actually, if we're doing this with staff and actually how we design our products, surely there should be something about how we work with patients, you know, and could we have a go at doing this? So 6 years ago, where are we now? 2004. Yeah, 6 years ago we started, and we went to one of the organisations who were a successful organisation, a friendly chief executive, and said, you know, actually we want to have a go at using design thinking, a design process in healthcare. Will you let us have one of your teams? And he said, well, okay, I'll let you have one of the best teams in the organisation. They're performing well. They get, you know, they achieve all their quality markers. They're a good team. And so that was where we did our first work with them. We worked with Paul and Robert, as Jocelyn mentioned. We worked with service designers, and looked at actually how we could use design thinking in healthcare. And that's where experience-based design, that's where our products, we then developed our products to support organisations in using experience-based design developed from. So what is experience-based design? Well, experience-based design is very much about understanding. Sorry, that shouldn't have moved on. It's about understanding patient and staff experiences to design better solutions. So in terms of the services that we deliver. So it's not just about patients saying what they want. It's not just about staff saying what they think should be done. It's actually about truly understanding experiences, and it's not about attitudes and opinions. So this is the process. So there's a fairly standard process to follow, and within that it's very much about establishing the core group, collecting experiences, so collecting patient and staff experiences, observing experiences, observing the services as they are delivered, and also understanding, so using that data collected to understand together. So then we develop that into a co-design event where they work together to understand what the service is like, to identify what the opportunities for improvement are, prioritise those together. So it's not about, oh, let's find out what's going on from the patient perspective, that we'll still decide what we're going to do because we know best. It's then about prioritising together, and then working on the solutions together, developing the solutions together and implementing. And then importantly, really important to celebrate and actually decide where you're going next with it. So really celebrate achievements and working together and the difference that can make. So I'm just going to take you through those phases. So the first one is about establishing the core group. And, who might you want to include in that core group, and what role do they have? I must keep pressing something by accident, I don't know. All fingers and thumbs. So within that core group, you would want to ensure that you have some senior decision makers, that you have somebody who can say yes or no, someone who has some financial accountability, budget holders. Also ensure that it's multidisciplinary. So have patients on that group, have different clinicians, have admin staff, have managers, but try to make sure that it's not too big. So, really be clear about who that core group is. You can also have a wider steering group or critical friends group, but you really need to have that clear core group who have responsibility for the project. And making sure that there's that leadership from the top, so that actually it's, we really, really want to do this, and we can show that throughout this programme. But also, that they're open to access from the teams, so we're getting the bottom up as well. So ensuring that there's that open door policy and there's access. The core group is really about guiding the process, ensuring that the resources are there, and trying to sort of help to knock down any of those barriers. Knock down sounds a bit violent, doesn't it? But, you know, to try and get rid of some of those barriers and understand why they're there, but actually try and manage some of those. So it's really about, the core group really needs to be able to do that. I can move on now. The next bit is about collecting experiences. And in terms of I'm going to put this down, I think. So collecting experiences, and it's really important within this that you think about different ways of doing that. So within experience-based design, we use narrative. So gather people's stories, really understand the stories of their journey. And we would suggest that you do this from using unstructured interviews is a great way, and just get people to tell their story. And, you know, in some of the services, you might want to do that in a very small particular area, so it might be just about hospital care, for example, or for others it might be about a whole journey of care. So, for example, we've done some work with patients with multiple sclerosis, and when we were doing that particular piece of work, it was tell us about your journey, you know, tell us about pre-diagnosis right through to the current day, your interactions with services, healthcare, social care, voluntary, you know, sort of, and as you felt as you went along the journey. So just be really clear when you're doing this, thinking about where you want to collect the evidence from. Because, you know, if we focus just too much on too narrow an area, sometimes we can forget about what's happening to patients and their families before and after our services if we're not careful. So really being clear about that. Starting with staff can be really valuable because it can help to engage. So it can help staff to realise that they're being listened to, that they're important, their stories are important too. It can also, it's really important as well because we want staff to engage patients in the whole process as well. So if we can get them on side to start with, so really understanding it from their perspective is really valuable. And also it helps to build the trust across the whole process. In terms of patients, and we use the word patients here, but we also mean patients and families and caregivers, and we would include stories, their understanding of what their journey has been like and their interactions with the service, what the issues have been, what some of the barriers have been. And basically we would say that you would want to try and gather some stories from people across the service, so trying to get a mix of patients, maybe some of the hard to reach groups as well. And you probably only need 5 to 10, a maximum of 15 patient and family interviews, because what happens is as you start to do them, you start to get repeating messages, and as you start to listen to the stories, you start to get the same things being told, and so you realise quite soon when you've got to enough. And also alongside this as well is observation is a really key part. So see what's happening, you know, just observe, and actually getting patients and families to observe what's happening as well is really very powerful. So just sort of, you know, actually what did you see when you were accessing that clinic?
Yeah, there's always a lot of waiting around and things like that, but I've learned to manage that bit. I really understand that there is going to be a lot of waiting around, you know, hours and hours sometimes, but I'm okay with that, and have been okay with that so long as I feel that you haven't been forgotten, and that people, when you actually get to see somebody, you will get some time, and that will be explained. And I always felt that in the oncology clinic. I was treated very well, and things were explained to me.
I mean, there's something really great that they do, that so many of the tests so quickly once you're in the system. Like I had the fine needle for their biopsy, and then my mammograms and it all happened very quickly. They call it one-stop something or other, and I think that must be a new thing, and that's very, very good. I was also very, very lucky because I managed to see my oncologist for every 3-week visit. I managed to see him the whole time, so there was consistency there. Again, at the very beginning, there wasn't consistency. I was seeing this doctor here, that doctor there, and that was a problem.
I think if you don't see your oncologist, which on 2 occasions now I haven't, and I mean I know 2 of them, and I've seen neither of them, then it seemed almost pointless going to the clinic because the person I did see knew nothing about me and didn't seem to be able to get enough out of the notes to be of any use.
People smiling a bit more at receptions, you know. You're being greeted by somebody that just, yes, your name, you say who you are, you smile. You may not feel like smiling that day. You really may not feel like smiling that day. But it would be nice if someone said to you, well, good morning, if you'd like to take a seat, the consultant will be with you shortly. If you'd like to have a drink, help yourself, by all means. Tea, coffee, hot chocolate, water. And there's magazines for you to read, which there isn't.
You manage the really big stuff. You know, you've got cancer. It's terrible. You lose a breast. You lose your hair. It's all really, really difficult. But it's the small things that can really tip you over the edge, I think, or because you start to feel that if the small things are wrong and if nobody knows who you are, you lose confidence and you don't feel safe and you feel belittled in some way, I think.
And I think, you know, Jocelyn was talking before about the elements of transactional and relational aspects of care. And I think, you know, some of the things that were happening there, they were very much about, you know, it was about those relationships things. It was about, you know, it was great when there was consistency of me seeing my oncologist. And it would be great if I saw my oncologist, you know, I mean, just to hear those two contrasting sentences one after the other. And then, you know, it's the little things that make the difference. You know, it would be nice to be, you know, you go and read the magazine, but there are none, you know. And and quite often if there are, they're out of date by 3 or 4 years quite often. So, you know, it's just an example of what you can use. I mean, obviously, if you've done interviews and the best way is to video them, you know, to have those video clips are really powerful. And you might find that there are some issues potentially, you know, people might say, oh, we can't get consent to do them. Generally, it isn't a problem. It might be an organisational issue, but actually for the patients and the families, it generally isn't an issue in terms of the consent. We've not really had any problems with that. It's often been organisations saying, oh, we can't do that for governance reasons or whatever, putting those barriers in the way, which is why you need that senior leadership to help remove some of those barriers. So once we have those experiences from staff, I didn't touch it then, from staff and patient perspectives, and families' perspectives, it's then actually what do we do with that? So then it's about understanding it, and some of that you might want to pull together with staff initially and patients on their own, but then actually the important thing is to start to bring them together and to bring patients and staff together and start to look at actually, so what is happening? What's the experience like for us receiving and for us delivering, whichever side we happen to be on. So the co-design event, what we do within that is there's looking at mapping the process, and here you can see there's, I don't touch this because I keep pressing the wrong button, but along the top there are sort of the main process points, so sort of the high-level process map. And then underneath we have sort of how do people feel at different points on this journey. And what we would say is that you start to really build that up from the video stories, from the patients and from the staff and the families, and start to really identify where the touch points are. And the touch points really are where there are interactions with the service, so where patients and families interact with the service, but which cause heightened emotions. So some of that might be really positive, and that's okay, but some of them might be really negative. And wherever those heightened emotions are, then actually that's where we can design improvements, and that's where those opportunities for improvement are. And once you've decided what those design areas are, where the opportunities for improvement are, it's then actually how do we prioritise and how do we decide what we're going to work on. And again, we would actually say that, you know, the important thing is that it's actually about working on that together. And working on that together, identifying what the priorities are. I'm going to check the animations on this afterwards because I'm sure somebody's been playing with it. So it's really about understanding where those priorities are and developing what your design rules are about those. So actually, how are we going to work on this together? And within the co-design event, we develop co-design teams who will work on particular areas together. So that might be about information, it might be about reception, it might be about the one-stop shop. Did you call it one-stop shop or whatever it was called? But actually, you know, so it might be about any one of those things, and you actually then work together. And within those co-design teams, you will have patients and staff and families together, and the facilitation, the important thing is actually about the facilitation of those sessions and those groups, that people are there on a level playing field, that it's not about hierarchies, it's not about staff saying we know best or patients saying we know best, it's actually about everybody working together. And then the important thing about making the changes is really about working together again on making those changes and testing and doing those small scale testing and doing that prototyping. So when a solution has been, you know, decided on or thought about, then actually to take that and build it together and build something really simple. So prototyping, you build something that's really simple and easy to test, and then you develop it further. You know, it might be that when you first test it, it just doesn't work at all, and then that's fine. You know, just test it with the next few patients. If it doesn't work, then take it away and rethink. But really about learning by doing together. The priorities for patients with breast and lung cancer were quite different, which is with some particular work that we did. And the lung cancer was communication of diagnosis, information about treatment, and continuity and coordination of care. Whereas the breast cancer was much more about, there was functioning of the day surgery unit, the appointment systems and conduct of outpatient clinics, communication and information about symptoms. And one of the things we find out with most of our projects using experience-based design is information and communication are two key areas. They always come out as key areas. Within healthcare, patients are often really seen as the consumer. They use our services, you know, they take what's offered to them. But this is really about active participation. It's really about it being, you know, this isn't just about involvement and engagement, it's about true participation in the design process.